It was a real pleasure to present on behalf of my co-investigators the results of our mezigdomide expanded cohort or dose expansion phase of our phase 1/2 study. This was not a small number of patients. It was 101 patients in an international setting from multiple centers. And we had established in our phase 1 portion of the study the recommended phase 2 dose, or what we call RP2D, but basically in that study we demonstrated that the RP2D was 1 milligram 3 weeks on, 1 week off, with dexamethasone partnered weekly. We brought that into this expansion phase, and in the expansion phase we treated relapsed refractory disease. They were all triple class refractory. We treated patients who had also had received prior BCMA in about a third, and we also had patients enriched for high risk with cytogenetic abnormalities as well as extramedullary disease, and the extramedullary disease was present in about 40% of the patients. So we were very pleased to see what we saw in terms of results. We saw a 41% overall response rate that proved durable with a respectable PFS. We're also pleased to see that in the subgroups that we'd pre-specified as being important to analyze, this included prior BCMA exposure and extramedullary disease, we saw a response rate in the prior BCMA exposed patients of 50%, and we saw extramedullary disease respond to the tune of 30%, which is quite encouraging. And certainly we saw similar types of results from melflufen, for example, but obviously this is an oral approach and had the additional advantage of being very convenient and actually generally very well tolerated. And I think that's the other aspect of the study. For an all-oral therapy, we saw excellent tolerability overall with a manageable side effect profile. And given that we enrolled patients during the COVID pandemic, we were encouraged to see, even though we did see COVID infection, that there was only one COVID death in over 100 patients, which is very important because we've obviously seen that COVID-19 mortality can vary depending on the study and depending on the class of drug being tested.